Hello, I'm Phil.
Hi, I'm Rachel.
So we are here again today to talk specifically about shockwave therapy and whether it hurts. So that's a question we always get is, does shockwave therapy hurt? You get that question, Rach?
All the time.
Yes. So our job today is to show you exactly close up what it sounds like, what it feels like, and answer that question whether it hurts. So the machine is here. It looks a bit like R2-D2. And we're going to fire it up and demonstrate to you exactly what it does. So how about we do it to my hand?
Yeah.
So my hand here is no tricks. This is my hand. So that's not hurting. If you push a bit harder, so that's not causing pain at all. What it feels like, it sort of feels like a sort of electric shock. Now it's not called shockwave because it causes electric shock at all, but it's actually an acoustic pulse into the tissue. But that wasn't painful at all. That didn't hurt at all. Now, Rach, if you have a patient who's got, say, heel pain or Achilles tendon, is it ever painful when you use the treatment on their painful foot?
Yeah, so it can be a little bit painful. It depends on how inflamed it is at the time. The idea is to bring extra blood flow. So if there's inflammation there, we want to lower that first and then get started on shockwave. But yeah, we start on a low setting to start with anyways.
I think that's the important thing to realise is we don't just let it rip we don't do that. We can sort of tailor it down. We can turn it up or down based on the frequency on the bar, which is the actual the pressure, the speed at which the projectile hits it, and the number of pulses too. So we can change it all up. So the way it actually works, if you look at this picture behind us, this is the headpiece. So actually running up and down through this headpiece here is a projectile. So I think it's copper, I believe, and that projectile rushes backwards and forwards and hits the end, the active end, which then sends those acoustic pulses in. So that's how it works. We often get questions on how it causes a response to the injured tissue, right? So you mentioned before people with heel pain or Achilles tendinopathy, so they've got those chronically injured tendons and fascial tissues. So if you've just injured your foot and it's hurting today, this isn't a very good option, but it's perfect for people who've had the pain for weeks, months, and sometimes even years to turn that chronic injury back into kind of reset the healing phase. So we're always using it with other treatments. So what are the other treatments you would usually use as well as the shockwave for someone with heel pain or arch pain?
So other treatments are like our custom foot orthotics. Usually there's something more going on with the foot, either biomechanically or footwear, whatever it is. If we try and address those components first and lower the stress going through the Achilles or the heel, any of those tendons, then bring in the shockwave, tends to heal up really, really quickly.
Yeah, it sort of just speeds up that healing process and kick starts it when it's gotten bogged or stuck. So yeah, it's a great treatment. So look, if you have more questions, we think we've answered the questions most people have, but if you want to know more about shockwave, whether it hurts or any other questions at all, you can call our clinic or you can just make a comment on this video because we look at all the comments and we can reply to your message or direct message you as well. Whatever is easiest for you. But if you have heel pain, arch pain, Achilles tendon pain, we use this all the time for those and we get great results. Usually people will need about a month of treatment, so it'll be once a week for a month, and we can get people's pain from here down to here pretty quickly. So we'd love to help. I think that's enough for today. Rach, what do you reckon? Yeah. Okay, thanks for watching.
See ya.
Bye.